Hello, good afternoon, doctors. On behalf of Hetero Healthcare, I, Dr. Prashant Khandeparkar, welcome you to this webinar on recent advances in intimate health management. Doctor, as you know, at Hetero, we market products in multiple therapy areas like gynecology, dermatology, gastroenterology, ortho, etc. We have a very strong R&D background, which is why we try to develop products keeping patient benefit in mind. Our endeavor is to improve patient compliance because we believe that if the patient compliance is good, ultimately clinical outcome would also be good. We have developed NSAID patches, reverse ligament patches for patient compliance. Gynecology, obstetrics, and IVF is an important therapy segment for us at Frenza. Apart from oral tablets like Didropal and Mylotin, we market products for vaginal health like Femonara and Pelvic. We also market a vaginal film recently, which we have launched under the brand name Silero. The film contains lactic acid along with fructooligosaccharides and tritiol. The film is supposed to correct the vaginal pH and maintain it at acidic pH so as to protect vagina from infections. To speak more about vaginal conditions requiring vaginal film, the product, and share clinical experience, I have the pleasure in inviting Dr. Neelu Prasad. Madam, Dr. Neelu Prasad is MS, DGO, DNB, PhD, and PG Diploma in ART from Kiel, Germany. Madam is Assistant Professor in NMCH Patna, Chairperson International Academic Exchange Committee, POGS. Madam is trained in hysteroscopy, specialized in infertility, laparoscopy, hysteroscopy, ultrasonography, and cosmetic gynecology. It gives me great pleasure in inviting Dr. Neelu Prasad. Welcome, madam. Welcome once again. All yours.
Thank you very much to whole team of FETRO and giving me this opportunity. So today I am here with a very important and common topic, that is intimate health management. So it's my great pleasure to give a detailed information about the latest treatment in this scenario. So now, my topic is intimate hygiene is all about keeping your private clean and hygienic. Daily gentle cleaning of the vulva is an important aspect of the feminine hygiene and overall intimate health. So about the vaginal pH. Vaginal pH having a key role in maintaining the hygiene of vagina. Vagina is a self-cleaning machine. Clear, white vaginal discharge are normal and an indication that it is perfectly healthy. However, if the discharge is smelly of a different color like yellow or green and causing itching and soreness, the chances are high that it might be due to an infection. Vaginal flora and vaginal pH play a significant role in intimate hygiene. About vaginal flora. Vaginal flora, vaginal microbia, vaginal microbiome are the microorganisms that colonize the vagina. A healthy vagina, both good and bad bacteria coexist in a balanced way. The primary bacteria of a healthy vagina are of genus Lactobacillus. Lactobacillus protect against the pathogenic species. So about vaginal pH, the acidic pH of a healthy vagina ranges between 3.5 to 4.5. The increases acidity from the natural protective shield to prevent harmful germs and other microorganisms from intruding. A pH above 4.5 makes the vagina susceptible to the vaginitis or inflammation of the vaginal tissue. So lactic acid support the maintenance and the restoration of the naturally healthy vaginal flora. So the vaginal pH is therefore determined by the sum total of the lactic acid production by the vaginal mucosa and the microbial flora. So importance of vaginal pH is that the normal 7 is the neutral and 0 to 7, it signifies the acidic pH, and 7 to 14 signifies the alkaline pH. So the healthy vagina have a balanced pH to maintain the infection and the condition, intimate condition of the vagina. So now, how the pH of vagina is maintained? So how the lactic acid production is going on? So the production of lactic acid, it is totally dependent upon the hormonal status of a female. So estrogen is a very important hormone that helps in maintaining the pH. So vaginal mucosal membrane, it acts by the estrogen. It acts on the glycogen and convert this glycogen into the lactic acid. So the lactic acid bacteria are present as a normal flora. They convert the glycogen into lactic acid. So what are the benefit of this lactic acid? They hamper the growth of the pathogenic bacteria and helps in colonization of the lactic acid bacteria. Also, it induces the growth of the lactobacilli and create an acidic environment, and it ranges from the pH 3 to 4.5. So the natural protection system prevent the infection and maintain the vaginal health. So these are the flow chart, how the lactic acid is produced. And lactic acid, the hamper the growth of the pathogenic bacteria, colonize more lactic acid bacteria, induces more lactobacilli growth, and creating an acidic environment, that is the ranges between 3 to 4.5, and regulate the vaginal pH. So the normal vaginal flora is acidic vaginal pH and vaginal discharge are all the component of the intimate defense mechanism that protect against vulvovaginal infection. So this is the pH that prevent any vaginal infections. So now come to on pathophysiology of the disturbed vaginal flora. So normally the lactobacilli are present in the vagina, and the volume of the lactobacilli decreases in various conditions. And whenever there is a decrease in the lactobacilli, there is also decreases in the concentration of the H2A2 lactobacilli. So these all are due to the lifestyle modification or might be due to the age. So they causes raise in the vaginal pH. Whenever the vaginal pH is raised, there is increases in the overall growth of the pathogen that cause infection of the vagina. And the vaginal infection, vaginal discharge, fishy odor, and they ultimately lead to the infertility and STD, sexually transmitted disease. So all our effort that is due to the changes or alteration in the pH of the vagina. So now come to the symptoms. Whenever the vaginal pH is altered or there is imbalance between the ranges of the pH of the vagina, then what the patient complain. So most important complaint that is given by the patient is the discharge, about the discharge, that is the strong fish-like smell discharge. Sometimes it may be gray, green, or foamy vaginal discharge. There is presence of itching around the vagina, swelling and irritation around the vagina, pain or burning feeling in the vaginal during sex, and the burning sensation while she is urinating. So these all are the symptoms of unbalanced vaginal pH. So now come to on what are the condition and what are the main factor that cause disturbance in the vaginal pH. So one to one, I would like to explain about everything, like the menstrual cycle. At the time of the menstruation, the pH of the blood is around about 7.4. So during that period, the pH is elevated. Normal pH, the ranges is 3.5 to 4.5, but at the time of menstruation, the pH of vagina is raised. So in this time, most of the women bodies can handle the differences, but some find that they are prone to infection during or after the menstruation finishes. The other causative agent are the medications. There are various medications like antibiotic medications. They also cause vaginal pH increases. And because the medicine has to kill the bacteria, so both they are good as well as bad. There are some birth control pill. They can also cause alteration in vaginal pH. Together with they ultimately cause infections. Now, douching. Douching is a method of cleaning of the inside of the vagina, and it is different from the washing outside the vaginal area with the soap and water. Douching usually involves squirting a pre-packaged fluid mixture into the vagina with the tube or the other tools. So this process can also rise the vaginal pH. Some people use lubricants. Lubricant also reduces the dryness in the vaginal area during sex. And some lubricant products have a pH higher than 4.5. So this higher pH can kill healthy bacteria and lead to an infection. So these all sorts of things that cause alteration in the vaginal pH that cause future infection in the vagina. Other conditions like the breastfeeding and the menopause, the hormone, especially the estrogen, and they play important part in keeping the vagina healthy and the pH acidic. When the women breastfeed or started menopause, the estrogen level is low, and sometimes resulting in a condition like vaginal atrophy and causing higher vaginal pH, because all the physiology of the body that is changed during the breastfeeding or during menopause stage. So now there are various antimicrobial therapy. Whenever there is alteration in pH, there is a infection. So there are various formulation available that is used to treat the infection of the vagina. The important drugs are the clotrimazole. It is a topical imidazole, a drug of choice for the vaginal yeast infections. It is available in the form of topical cream, vaginal insert, and other formulations. The 1% cream is used daily for 7 to 14 days, and in the form of insert, 100 milligram. It is inserted daily for 7 days or twice for 3 days, and sometimes in a steroid dose, 500 milligram as a single steroid dose. Other medicines like miconazole, it is also a topical imidazole, a drug of choice for the vaginal yeast infections. It is available in the form of the topical cream, vaginal insert, or the cream also. So 2% cream, it is daily used for 7 days, or sometimes it is available in the form of insert. 100 milligram is inserted daily for 7 days, or 200 milligram for 3 days. And sometimes it is in a 1200 milligram as a single dose. Nystatin is another formulation. The only preparation for the topical use on the skin are non-prescription. These are the vaginal insert or cream. 1 lakhs international unit once daily, and for 14 days it is used and having a very effective role. Turconazole as a topical imidazole, a drug of choice for the vaginal yeast infections. It is available in the topical form or in the insert form or in a cream form. So 0.4% cream is used daily for 7 days, again 0.8% daily for 5 days, and also available in 80 milligram, the insert daily for 3 days. So next one is the fluconazole. It is a very common drug. Everywhere it is available. So it is a drug of choice in the vaginal yeast infections. So it is orally active and 150 milligram as a single dose. It is effective to control the infections. The next one is the metronidazole. Metronidazole is a drug of choice for the trichomoniasis and the bacterial vaginosis. So for the trichomoniasis, 2 gram, it is an state dose used, or otherwise 500 milligram orally given for 7 days. And for the bacterial vaginosis, it is the 500 milligram twice daily for 7 days, or 2 gram once daily. It is also available in 0.7.5% gel that is used twice daily for 5 days. Again, the next one is the ketoconazole, a second-line therapy for the vaginal yeast infection. It is orally available, 400 milligram twice daily for 500. And clindamycin, it is a drug of choice for the bacterial vaginosis. It is used as an orally or the vaginal cream or the ovulate. 300 milligram twice daily for 7 days, or 2% cream is available, used once daily for 3 to 7 days, and 100 milligram in ovulate for 3 days. So these are the vaginal infections where the all form of local and tropical medication is given. Although they cure infection, but disturb the vaginal flora and leading to the recurrence and untreated root cause. So there are various formulations available in the market for the tropical use or maintaining the vaginal flora, but they are not long lasting, and even they alter the pH of the vagina, so not very effective. Now, current treatment and the needs gap are there are the various formulation available like lactic acid wash, some suppository, vaginal gel, soft gel capsules. So when one use the lactic acid wash, they wash out even the good bacteria and lack of adherence to the vaginal surface. Suppository, they leakage the issue due to the use of the high suppository and bases and inconvenience. Vaginal gel, it is having messy application. Accurate drug delivery is not possible due to the sticking of the gel on the hands or on the application. And next one is the patient discomfort due to non-flexibility of the material. So need of right therapy option for sustainable result in balancing the vaginal pH. So all having some sort of problem either in using proper dosing and their efficacy. So the right choice for balancing the vaginal pH is now in the form of lactic acid vaginal films. So this is the need of the revolutionary therapy in the form of the film. So what are the advantages of the vaginal film? So previously, I discussed about the different formulations. They having inconvenience is the application and proper dosing problem. So the advantage of the vaginal films, that is a revolutionary formulation available nowadays. They're having longer residence time due to the use of bioadhesive polymers. So they persist for a longer time. Convenient application. So application is very easy. So lack of leakage, there is no chance of any wastage. Faster drug release is there, and patient comfortability and due to the film flexibility is more, increased stability even at extreme storage conditions. So there is no issue of any maintenance of the cold chain and their storage problem. So storage is very easy and simple. So pioneer in the vaginal therapy, there is a revolutionary therapy, a vaginal care management to balance the pH, to bridge the therapy gap. For the first time in India, Silero, a lactic acid vaginal gel. So the Silero having combination like lactic acid, this restore all the imbalance of the vaginal microbiota and restore the vaginal pH ranges 3.5 to 3.8 to 5. So now its formulation, it having FOS, fructo-oligosaccharides, its formulation is there, and they promote the growth of the lactobacilli and secretes antibacterial substances. And at the same time, they balance the vaginal pH. So these are the benefits of the fructo-oligosaccharides. So added benefit of tea-free oil that helps to clear the vaginal thrush. At last, a revolutionary formula of lactic acid for the maintenance of vaginal pH. Hetero Healthcare has introduced Silero, a lactic acid vaginal film, 220 milligrams, and a wow for the healthy vagina in vaginitis, bacterial vaginosis, and vaginal candidiasis. For the first time in India, having faster and accurate drug delivery, longer adherence to the vaginal surface due to the bioadhesive polymers, and flexible film ensure patient comfort. Easy to carry, easy to use, and easy to tear. And with this, I'm very thankful to Hetero for giving me this opportunity. There are some instructions for the use. Patient should wash the hand first. Patient should roll the film on the dry finger. Patient should be in comfortable position and insert the film into the vagina, and patient should wash hand after insertion. So cut the pouch from the three side, remove the film, and use according to the instruction mentioned on the film also. It is very easy to use. So this lactic acid vaginal film, 220 milligrams Silero, its dosage is 1 thin film at the bedtime daily for 5 to 7 days. It is available in the form of film inside the pouch, very easy to use. So thank you everyone for patient hearing. I think any question regarding to this newer molecule?
Yes, madam, we have received many questions. Thank you so much for a wonderful session. In fact, this is a revolutionary therapy, as you rightly said, and is likely to change patient compliance and ultimately the clinical outcome. Madam, how far do you think vaginitis is common in diabetics?
So vaginosis, vaginal dryness, these all are very common in a diabetic patient, because in diabetic, whole of the metabolic process is disturbed.
Absolutely.
And in that cases, the patient comes and present with lots of vaginal problem, like dryness, and there is swelling, itching, and discharge, having foul smelling discharge. and the sugar level is high, so that other molecules, they are not properly act at that place.
Absolutely, absolutely. And the patient's immunity also goes down, both oral,
Yeah,
topical and
definitely.
oral.
In
Yes, yes,
Yeah, definitely. In case of diabetic patients,
yes.
it is a syndrome that affect all the system,
Absolutely.
diabetes. Or in that case, definitely the immunity gradually gets
Correct.
down.
How long you think, madam, the field should be ideally prescribed? Although we say 5 to 7 days, 7 days is more ideal, I suppose, as compared to 5 days for best results.
So whenever the patient comes, we have to search into so many problems also. Since how many long she having, associated any condition is there or not. If everything is settled, the normal usual dose is 5 to 7 days. It effective, and when we ask the patient to come again, and in that condition, we take the complete history. If needed, we try to know about the condition, how much it improved, and we prescribe it in a second setting.
Correct. Would you prescribe it along with active treatment? Like, for example, someone is prescribed clotrimazole, topical pessary or some such thing. Would you prescribe it along with that or before or after that?
Actually, this is the newer molecules.
Correct. So we do not have any experience. Yes.
So we don't want to lose our impression, our everything. So we have to advise some antihistaminic also.
Absolutely.
Sometimes if the patient having itching, sometimes
symptomatic
patient
relief,
having burning sensation. So we some supplement like alkalizer or something we use also for the local application, so that the patient can feel more and more supportive treatment also.
Correct. What is the incidence if patient is on estrogen inhibitors, like say anastrozole or letrozole for breast cancer? You think it will be common? The incidence is very common in those patients. If patient is on estrogen inhibitors for breast cancer.
So the condition is not so common.
Okay.
And according to the latest treatment protocol, we advise some formulations also.
Okay. Do you think, madam, that inhaled, like oral corticosteroids will certainly aggravate the treatment, but inhaled corticosteroids taken by asthmatics, will it lead to this condition? Alter the pH rather?
Individual variation is there. Someone having very good results, someone is not responding. It depends upon the conditions of the patients. And underlying conditions they having.
Absolutely. Is it like we recommend it at bedtime? And in your experience, is it okay to use it at any time of the day or bedtime is the best?
Now that depends upon the lifestyle. Some patients are comfortable using at morning time, afternoon time. So according to your duty hours, whatever the comfortable time. So what daily dose is important, but the timing is not very according to their own schedule.
And of course, this question is rather early. What is patient experience in terms of local tolerability or clinical response?
It's very good.
Very good.
It's very good.
Nice
and some it is to the doctor also using some new formulations in the form and the patient also. So we have to convince that this is the for the first time you use it, and definitely you will get better result. So patients are agree, they convince, they believe on me, and they go on, and really they are satisfied.
But that's very important. That's very important.
Yeah, really, feedback is very good, and the patient is really satisfied.
That's very important. I think that is all, madam. Those are the questions that we received from the field. But any other questions, we'll definitely come back to you. Thank you once again for this lovely session, and wish you a very good evening.
Thank you so much. Everyone, to the whole team for giving me this opportunity.
Thank you.
Thank you all.
Yeah.
Okay.